Hello there, welcome back to my YouTube channel. My name is Chine Obi. So this video is actually a random thought. Someone sent a message on my WhatsApp concerning a status upload I made, and this is the reason for this video. I have never actually thought about it in that angle, but after the chat and sending a voice, and I decided to share this. Yes, as a nurse, it's not easy to actually work with people sick, ill, debilitating patients, and also seeing corpses almost every day, or having to do last office for the dead almost every other day. Sometimes it could mess with our mental health. So I'm speaking to you if you're a nurse, or if you're in a profession, maybe like the military, or any profession that has to do with the loss of lives on a daily basis or any other day. This is me encouraging you today and advising that you should be mindful and take care of your mental health. Why am I saying this? Just in case you're working as a nurse in Nigeria or in Africa, where the healthcare system is not so palatable, where you improvise so many other things to in order to carry out procedures, where you have to do things not as it should be, or sometimes when you're short-staffed, when you have to work not just as a nurse but maybe as an orderly, as a health record personnel, as a pharmacist, or any other thing in between, and you see that most times the job gets a toll on you because you're doing so many things at the same time, and sometimes it gets to you, get to have rants or throw tantrums at your patients or clients, even when it's not their fault. Sometimes you need to sit back and take a deep breath and actually have a me time, like do things to re-energize you again, do things to guide your mental health and your mental space properly. Most of these things we don't know that over time it gets a toll on us, because we get to see the bad side of life, or the critical state of health or illness. Sometimes illness, for me myself, it actually made me to value life. I see every day you're alive as a blessing, as a privilege, to stay grateful. I see the fact that I'm in a health sector has actually prepped me better. Yeah, aside my nature, that's what I was taught growing up. Being in the health sector actually also helped me to appreciate life, to appreciate what I have better, to be contented, to be grateful for every passing day. So, but that comment actually gave me a different angle to it, or a different perspective, in that for some of us who are into this career path, health, life might mean nothing, because we've seen deaths every other. We see deaths every other day. We see the critical illness. We see how people get to die. We see the nothingness of life and the health. There's just a thin line between health and illness, or health and death. So some of us might actually not value life the way it ought to be. We might not even see life as a big deal anyway, because we know that there is nothing in it. We know that it only takes a twinkle of an eye. Basically, it actually takes just 3 to 5 minutes for the brain to die. So if the brain is not receiving oxygen, it actually takes between 3 to 5 minutes for the brain to die. So it just like how many 1/words of an hour. So imagine that some of us might actually take health to be nothing, as opposed to myself or someone else who might take life to be very valuable because of the mindsets we decide to pick up in life. So with this, we ought to guide our mental health properly, jealously. Sometimes it's not even what we do out of our making, but because of the situations, because of the events around our workplace, events around our exposure over time must have actually shaped us to be this way, not necessarily because that's who we are. You see some people saying that nurses are wicked, nurses are heartless, nurses are this. Sometimes it's actually because of the exposure we've had with our workplace, with the severity or the pressure at work, especially when in a setting whereby you're short-staffed, you have too much work to do with very little number of nurses to do this or health personnel to do this. You're choking, your pressure is too much, and you lash out on patients, you lash out at people. Over time, you notice that your temperament has increased, your level, your anger level gets spiked over little things, or you get pissed off, you get temperamental over issues that normally you do not get angry over. Sometimes this is actually shaped due to the exposure we've had in our workplace over time, not necessarily because of who we are. So this is just to encourage you to please guide your mental space, guide your mental health properly. While we teach others to do this, please, we are in that position to also do that for ourselves. We have to also educate ourselves, even while we educate people. Sometimes even when we educate people, we tend to forget that we are actually tolling in that path where we are even encouraging or advising people not to toll in. That is why once in a while we have to sit back and reflect on ourselves, on how our day went, how we were able to relate to people, how we were able to relate to situations, so that in the long run we do not get to be a victim of what we are actually advocates for. I hope I made sense with that. So we don't get to be victims of what we are advocates for. So please, this is just sending love and light to every career professional who is in this aspect or whose job deals with lives, deaths, and interacting with people at critical stages of their lives. I am giving you love and light, giving you all the hugs you need, and giving you the forge ahead that you're strong, you can do this. But at the same time, please guide your mental space jealously. Thank you for watching. I hope you got value from this. I hope you get to make amends after today, or sit back, reflect on yourself, and make a conscious effort to do better. Just in case you find out you're tolling in that part you do not want to, just make a conscious effort to seek help if you need to, talk to somebody, and be mindful of your reactions. Probably before you lash out, you count 1 to 10 before you speak. That way to help you speak calmly. So thank you very much. I hope you put this into practice. So remember to always stay healthy and create a happy place. I'll see you in my next video.